Dr. Kristie Ennis. Regardless of what is actually going on in the knee, we can do some work on our own with an instrument assist to help relieve some of that pain and improve function by working on some of the different structures and some of the different muscles that are attaching in that area. So I'm going to show you all of the stuff today. All right, starting with some of those actual structures in the knee itself. I've got the Derma Edge here, which I will link for you guys that I created, and you only need one device to actually hit all of these areas. One of the reasons I like it. Created it when I had Lyme, so it's also easy to hold on to. So if we start here and look down right at that patella, this is a common area to have pain when you've got jumper's knee or patella tendonitis, sometimes even a quad strain because that quad comes all the way down there. So what we really want to do is start to get some blood flow in it. So I'm going to take that Derma Edge and I'm just going to go right over that tendon. You want it to be a little bit relaxed, so even if you need to sit with your legs straight out, you can. We're doing this with about a moderate pressure, so it really should not be painful as you're doing this. I'm going up with the Derma Edge just to keep that blood flow right going up towards the heart for this. Now, where I'm directly on the tendon, we find that little bump in the knee and then come up a little bit higher. I'm going to take the little point here and I'm actually going to dig in a little bit harder, so moderate to firm pressure, and I'm going directly across the grain of that tendon. Tendons are notorious for having poor blood flow, and this is a great way to do some cross-friction massage without actually killing your fingers. So you do that until you go, that tendon doesn't feel so bad anymore, not as much pain. If we go ahead now onto the side of the knee or sides of the knee, and we're looking towards that joint line, right? So if you take kind of that middle of that kneecap and drop down, you'll feel, right, another bone here. This is an area sometimes where the meniscus can get inflamed and uncomfortable. So again, we're taking, and you're going to do a little experiment. Which way kind of feels a little bit more bumpy here? So we're going again at that across this time, maybe a little bit down. For me, it's here, and I do have some meniscus issues. So we're going to start again just by getting blood flow. Now keep in mind, this isn't going to fix the meniscus, but it is going to help some of that pain and hopefully allow you to get some more motion and function in there. So you can see on my leg, it's starting to get a little bit of red. So I am starting to get a little bit of blood flow going. You would do the same thing on the opposite side if need be. If you come down a little bit, again, kind of towards where that tendon and where that joint line are, you can get into some of those ligaments as well. And same idea, this typically, again, going upwards just to go towards the heart. And again, that moderate pressure until it feels either a little bit better or you're noticing some redness. If you're doing this over clothes, which you can, you'll go the other side too, just wear something that is not loose fitting so that you can take this right over it. You can do this right on the skin, or if you want to use some lotion to get a little bit of gliding, you can certainly do that too, but you don't need to. And again, I'm getting a little bit of redness here as well. Awesome, good. So now we're gonna move on to the muscles. All right, we're moving on to some of the muscles now that we've addressed some of those structures. Very common are some tightness or is some tightness in the quad muscles, and you've got 4 of them. So you're gonna do a little experiment. You're gonna go right up the top, you go over to the side, and then over to the other side. And what you're looking for here is what feels bumpy or bumpy-ist. And for me, unfortunately or fortunately, depending on how you look at it, it's all of them. So you're going to do a little upwards motion like this until again, it gets a little red or it feels like, oh yeah, that feels definitely a little better with moderate pressure. Once you loosen up the whole area, you want to pay attention to what spots felt extra tight. For me, one is right here. So I'm going to take this little edge, which is fortunately not super sharp, and I'm just going to push in again with about a moderate pressure. It should feel a little bit uncomfortable, but not terrible. And then I'm going to do a little active muscle release here. So I'm pinning this spot down, and then I'm going to kick that leg out. Same kind of concept that you're doing this until it feels a little bit better. And if you have more than one spot, definitely do this on all of those areas that you can. Moving up the leg, we're actually going to address those hip flexor muscles. One of those hip flexor muscles happens to be a quad muscle, and we've got some other ones that we want to address, which can be a problem and pull on all of these structures too. So if you kind of find the top of that hip and drop down, You can poke around a little and see, woo, what feels a little bit tender. Using this point again, we're gonna hang on to that spot, and this time I'm gonna lift that knee up. So as I lift that knee up, it should feel a little bit more uncomfortable. As I let it down, a little bit better. And again, of course, same concept. You're doing this until it feels a little bit better. You may need to do this on a couple spots in that hip too. For me, I'm a little bit off to the side, but not all the way on the side. So anywhere between front and a little bit off to the side is where you'll find those spots. Moving over to the side of that hip a little bit, and this one's easiest to do standing. So this is great even if you have hip pain, but some of these muscles in the hip, again, attach right down onto the side of the knee. So if you find that crest of the hip, that little curve in the hip, and drop down a finger or two, you're gonna use that little corner again, and whoop, yeah, you're gonna find it, trust me. This is your glute medius. We're gonna take and we're gonna bring this leg right out to the side and back in. And by now you kind of probably get it, right? As you bring it out to the side, it should probably be a little uncomfortable. And when you bring it back in, not as bad. This isn't about balance either. So if you need to hang on to something, you most certainly can do that. Moving on to the inner thigh, again, obviously muscles up in the groin, but still attaching around that knee. And sometimes this can even mimic meniscus, say that 10 times fast, issues. So again, to start out, really just getting into those muscles. You can go up as high as you can, but we don't want to go over the bone. And just like the quads, we're doing this until it feels a little less bumpy or maybe turns a little bit red here. If you found any tight spots here, you'll take that edge, and dig into that muscle a little bit, and we're going to add a little rotation in, in with the leg. Usually it feels a little bit more uncomfortable going out, and again, you can work right up the leg with this one. Hamstring muscles start up right at that hip crease basically and come on down and below the knee and attach. So again, can clearly affect that knee as well. So I'm going to take, and you can do again, a little assessment. Where does it feel the bumpiest? So if you find it's not so bad down towards the attachment, you can come up a little higher and just focus in on those areas that really need it, making sure that you get the middle and the sides and see which area or areas need it the most. To target those tighter spots, find that sore spot that you got, and then you're going to flex and straighten out that knee. Same principles as the other ones until it feels a little bit better. Lastly, we've got the calf muscles because they start down here and then actually come, I'm pointing to the side, come up above behind the knee there as well. So do an assessment again on the inside, the middle, and the outside. I find for me, this one is easiest seated, but you could certainly do this long sitting as well. For these tight spots, put that little edge right in that calf muscle. And this time we're actually going to use the ankle and the foot to help us release that. So you're going to bring those toes up and back down. I know I made a lot of noise with this video because I've got a lot of tight spots. So you guys at home, if there are some of these that you do a little assessment on and it doesn't feel tight, don't worry about it. You don't have to do every single area. Focus on the ones that are affecting you the most, and you should start to feel better soon.